Hi friends, welcome to my channel Learn with me Public Health. You are learning how for public health knowledge. Today's video is about epidemiology. It's a key subject in preventive medicine and public health research. In this video, we are going to talk about the basic concept of epidemiology. The epidemiology is not a new concept. Around 2000 years ago, Hippocrates is known as the father of medicine as an ideology of there is a connection between the environmental factors or causes for the diseases. So from there it started, but it bloomed in the 19th century. It bloomed with the evidence of John Snow, who is known as the father of modern epidemiology, who did a foundation for modern epidemiology with his work related to cholera. He identified that cholera is caused by the uncontaminated water before the period of the causing agent like a Vibrio cholerae, which is causing the cholera. So this is the evidence in the 19th century which put the foundation for the epidemiology. So he is the father of modern epidemiology. Now if we are talking, let's start with the simple definition. Epidemiology is the study of how diseases spread, why they occur, and how we can prevent them in population, whether it's in a small village or an entire country or a whole world. This word comes from the Greek, if you take as epi meaning upon, and demos is people, and logos. Epi plus demos plus logos, which means study. The definition is developed by the John M. Lost, which is the study of the distribution and determinants of health-related states or events in a specified population, and the application of this study to control of the health problems. Okay, then this is the explanation of those terms, the important terms in those definition. Study means not only like a surveillance, it's observational studies or experimental or analytical researches. Distribution means we can ask the question when it spread or where it spread, among whom, and classes of people affected. Determinants is the cause or root factor. It can divide into many factors: biological factors, chemical factors, physical, social, cultural, economical, genetic, and behavioral. We can take it as an example in the next slides. Health related states or events. It's not only disease, maybe cause of death, behaviors, and this reaction to preventive regimes, and provision and use of the health services, how many people are using this program or this scheme, how many people vaccinated against one disease. This is also health related states or events. Then specified population. It's not only related to we can categorize to age or men, women, or particular group of occupational groups. Then particular region people also we can tell. Then application to prevention control. Okay. Then this is some important points. Now we are coming to epidemiology has three major components, also known as the 3Ds. Disease frequency, which means how many people are affected, and distribution of diseases, and determinants of disease. This disease frequency means how we are going to measure using rates, ratio, and proportion. What we are going to measure, a disease, disability, everything, right? These rates are essential for comparing the diseases within the same population across different population to make any important step. Okay, also compass health needs, demands, activities, and tasks. It will quantify the disease effect to prevent or to control the disease by implementing any health related implementation strategies also, how much the government need to put their capacities according to the burden of the disease. The burden, it is defined by this disease frequency. Then distribution of diseases. We can distribute the disease can be distributed in one particular area. Example, dengue is spread in this region, in this state, like that. Then globally, example, we know the COVID limited to specific group. It is any occupational group or only among the men, only among the female. Example, cervical cancer only among female, or gestational diabetes only among pregnant women. It's like that. The distribution is 3 terms. Those are the important: time, place, person. Time indicates increase or decrease of disease over a period. Like we can tell, I already told it. Gestational diabetes only among during the pregnancy period. Or otherwise, dengue. Dengue is dengue outbreak will happen in a particular period of time of the year. So these are the examples for that time, place. Example, we can tell diabetes is more in US. Obesity is more among the people who have a westernized diet. Then persons based on the age and etc. Okay, then the determinants of the disease. These are the risk factors or causes behind the diseases. For examples, unhygienic environments, poor nutrition, genetic vulnerability, lifestyle factors like smoking, alcohol, everything. Then these are the aims of epidemiology. The goal of the epidemiology not just to study diseases, also but to act on it, to help us understand how diseases rise and fall in a population and identify what causes the diseases and how it is spread and during a particular period among the people. It depends on a particular place. Then find out who is most vulnerable. Okay, then develop policies to prevent or control diseases. Then this is also come under the aims. What is the distribution and size of the health related diseases, like a burden of the disease, what are the risk factors, and this is the planning and implementation of the health system implementation, everything. It's the ultimate goal to eliminate or reduce the disease. First point, what is the reason? To promote the health and well-being of the society. Okay, then this is the key objective, to study the natural course, how it started, to how we are going to diagnose, how to treat, and how to prevent, how to eliminate the full course of the disease, to determine the extent of disease in the population, to identify the patterns and trends in the disease occurrences, then testing public health programs, preventive future outbreaks, to identify the cause of the disease, everything. Then epidemiology is very useful in real world public health, studying the history of the disease, like how we predicted polio outbreaks. Then community diagnosis, finding out what health issues are common in the community. Evaluating the health services, checking if hospitals and clinics meet public health. And then another thing, identify the syndromes. It will come here. To identify the syndromes, to understand about the disease, to make a proper treatment, and completing the clinical pictures, determine the cause and source of the disease. Okay, here then the epidemiologist always begin with 2 things. It is an epidemiological approach. First one is asking questions and making comparison. Asking question, it's related to health related questions and health related to health actions. What are the health related questions? Health event. What is the event? What is the magnitude? Where it happened? When it happened? Who are affected? Why it happened? Okay. Then related to health action. What will reduce this problem and its consequences? How can it be prevented in the future? What action should be taken by the community? What difficulties may arise and how can they be overcome? First asking those questions and to get the answers, this is epidemiological approach. Okay, to identify the solution by asking the question. Then making comparison. There are two types: comparison between groups and comparison between individuals. Comparison between groups. One group having the diseases, the other group have not having the disease. Example of classic example of smoking and lung cancer. The particular group of people are getting lung cancer. We compare. One group of people don't have the lung cancer. We are digging deep into the determinants. Then we identified these people didn't smoke or didn't have the habit of smoking. These people have the smoking. So we are learning that smoking causes cancer, lung cancer. Then comparison between individuals. Like example, individual, one person's blood hemoglobin level, another person's hemoglobin level. This person has there is no other diseases, other any comorbidities. Okay. Then we are comparing at the individual level. We identified that this person has a very good consumption of nutritious food. This person has poor nutrition habits, so this causes for anemia. We are comparing between the individuals to get the determinant of the disease. So these are the epidemiological approach to identify the disease to prevent it. Okay, these are the basic concept of disease. This is a part 1 of the video. We will see other concepts in this upcoming video.